I'm moving through these, like, I just want to acknowledge this is the beginning of a conversation in a lot of ways. Like the practice of mindfulness, we're in relationship with that practice over the course of our lives. And as we continue to move through, research, and we get more information about what works and what doesn't work with different people, then things are going to move and shift. But what we're hoping to do today is to define medical trauma in this historical moment, kind of what we know about it, and hopefully to give you some tools to plan trauma-sensitive, mindfulness-based interventions with medical populations. And then Jack will also cover culturally responsive mindfulness-based interventions. And then we'll work to help you identify potential risks and harms when teaching mindfulness-based interventions, when working with people in various places on the ability spectrum and with diverse backgrounds. And so just some reflections for you all as you're coming into this training. You can feel free to put in the chat or just reflect quietly within yourself. Have you worked with, or are you working with, a patient with medical trauma as the primary focus of treatment? A lot of people might say no to this question. Sometimes we don't necessarily screen as in depth for trauma reactions to medical issues as they arise. And so if that's not the primary focus, see if you can bring somebody into mind as you're moving through this presentation so you can think about how to apply the skills here. Other reflections: have you yourself experienced a stressful or traumatic medical event? And if so, what was this like for you? And so here I really want to acknowledge again that a lot of us have been in our bodies for a while now, right? And so there may have been something that came up over the course of your history. And if that's true for you, please take extra care as you listen today. So, take a minute if you need to, get a glass of water, do something to take care of yourself as we're here. How have you used mindfulness interventions in your clinical practice? What have you seen? What have the benefits been? And then have you worked on an interdisciplinary team with medical providers? And if so, what challenged you in those settings? And so this gets at some of the edges of what we're here to talk about today. Medical settings can be challenging. Working with patients with diverse medical presentations and from different cultural backgrounds means we need to nuance a lot as we're offering any kind of mindfulness-based intervention. The other reasons this talk matters is that in the past couple of years here, the world has faced a global pandemic. And during the COVID-19 pandemic, we saw medical experiences like ICU stays spike. So they increased, and post-ICU, that's one of the risky places for the development of trauma and stressor-related disorders like PTSD. We also know and are increasingly confronted by the fact that medical disparities exist in our culture. And so what we see in the United States is that racial and ethnic minorities experience higher rates of illnesses like diabetes or hypertension. And so one of the reference works that I would like to recommend today is by David Treleaven, called Trauma-Sensitive Mindfulness. And in his work, he really highlights the fact that trauma survivors may have unique and distressing reactions to meditation and mindfulness. So understanding how trauma might impact the ability to utilize these types of intervention is crucial. And then also, I guess we're gonna see this unfold in real time, but I think we may see in clinical psychology and in mental health increasing numbers of people who identify as survivors of medical trauma in some way. And it would be good to know how to work with those people. Because with mindfulness, we're going to need to be able to focus attention, for example, and that may be more challenging if you're on different medications or if you're dealing with an illness or a disability. So just being aware of some of those edges, I think, is part of why we're here to offer this training. So let's get into some of the definitions. And on this slide, I'm actually offering 3 different thoughts. One is from the DSM-5, which clinicians use to diagnose mental health disorders. There's a couple of other people I want to bring into the conversation. So in the DSM, medical trauma is defined as something that has to be sudden and catastrophic. So we're not trying to over-pathologize the experience of illness, for example. I think that's part of where the DSM is trying to tread a line here. So what they say is that a life-threatening illness or debilitating medical condition is not necessarily considered a traumatic event. I do think we could debate what is sudden and what is catastrophic to a patient. And there's, I think, more to what people use the word trauma to talk about than just the issues that are kind of reported here in the DSM. So they do give examples like waking during surgery, anaphylactic shock, serious accidents or injuries, or witnessing a medical catastrophe in one's child. And so those are all things we want to hold with so much care in this conversation today. And in these other definitions, it widens the scope just a little bit. So the International Society for Traumatic Stress Studies talks about how medical trauma has both psychological and physiological components and responses. So we feel trauma in our bodies, right? And medical trauma itself is about the body. Hall and Hall, in their work managing the psychological impact of medical trauma, talk about medical trauma as something that occurs from direct contact with the medical setting and then develops through a complex interaction between the patient, medical staff, the medical environment, and the procedural experience that can have powerful psychological impacts due to the patient's unique interpretation of the event. And so in working with patients individually, I think this definition gets at a little bit more of what it's really like to have a medical event occur. And part of what these authors highlight is that it may not be sudden or catastrophic, but it is complex, and how a patient interprets the event matters. So let's get into this a little bit more. There are some unique pieces of medical trauma. And this is highlighted by Donald Edmondson in his work with the enduring somatic threat model, which just talks about, how with medical trauma, it looks a little different than other forms of trauma, which can be more discrete in terms of time and space, and also a little easier to avoid because you're not carrying the triggers around with you all the time. So with medical trauma, the threat is located within your body. So triggers are inescapable in some way. And when I use the word trigger, I mean things that remind you of the frightening event. And so there's also sometimes a less clearly time-bound quality. So whereas with a deployment, for example, someone could say, I went on deployment during these years, and then I came home. It may be a little easier to start to put things into the past and integrate them as memories instead of ongoing experiences. I'm not going to say that's always true. Certainly with other types of trauma, we can be experiencing ongoing reminders as well. But with medical, this is one piece that's pretty different. The other things that are true is that with medical trauma, ongoing medical care is often needed. So that's another place in space where triggers may not be avoidable and risk for re-traumatization can increase. And then the last thing to highlight here is that perception of ongoing threat can worsen the disease process. So this is something that I do see clinically where people will have, heart issues, for example, thinking of one person with a history of pericarditis, right? And then when they have anxiety on top of the heart issue, for like they heard they had high blood pressure, they begin to have panic attacks. And then the panic attacks keep going because they're anxious about their anxiety. They know that the stress can potentially worsen the heart issue. So things like that can certainly come up and make treatment a little more challenging and make it harder for the patient to put events in the past. And so this is the book I mentioned earlier. And one of the reasons I wanted to come back to it is that the authors highlight that it's not just acute emergency situations that carry a risk for a trauma reaction. what Hall and Hall highlight is that even planned and routine medical procedures can elicit a diagnosis like PTSD because of some of those patient-specific variables, like a person's history, right? The lived experience in their body comes with them into the medical room, of course. And so, like, I'm thinking of one person who had a nasal endoscopy and had trouble breathing afterwards. This was a planned routine medical procedure,